All right, let's talk about heme iron. This is the iron that has already been incorporated into animal tissues. It's also called organic iron, and it's a form of activated iron. It's found in high amounts in red meat, the muscle tissue of animals, and in some organ meats. The human body cannot block the absorption of heme iron. Therefore, when we eat a diet that is high in animal tissues and animal products, we end up getting more iron than our body needs, and that can promote disease. Again, heme iron is an activated form of iron that catalyzes all sorts of reactions in the body. Excess levels of iron are associated with increased risk for cancers, heart disease, diabetes, and infection. Heme iron can promote cancer by damaging the lipid membranes of our cells, which is called lipid peroxidation, or catalyzing the formation of what are called reactive oxygen species. That's what ROS stands for, and other free radical chemical compounds that can damage DNA and cell membranes. And studies show that it leads to a 12% increase in cancer risk for every 1 milligram of heme iron that is just ingested every day. So the more you ingest, the higher that risk is. Heme iron has also been shown to increase pre-neoplastic or precancerous lesions and to alter gene expression in cancer cells in ways that make the tumors much more aggressive. Heme iron forms compounds that are toxic to normal cells, but that are not toxic to precancerous cells. And it also catalyzes the formation of those carcinogenic N-nitroso compounds that we spoke of earlier. It lastly alters our colonic flora or microbiome in a negative way and induces cytotoxic damage that results in crypt hyperplasia or damage to the cells in the colon. These are references for this slide, and I would strongly encourage you to watch the Nutrition Fact video, nutritionfacts.org video on heme versus non-heme iron. Now let's look at heat-generated mutagenic carcinogens. In other words, the carcinogenic compounds that come from the way we cook and prepare animal tissue. You create these things called heterocyclic amines or HCAs and polycyclic aromatic hydrocarbons or PAHs that are formed when muscle and organ meat from mammals, fish, or birds is cooked at temperatures greater than 260 degrees Fahrenheit, which would include broiling, roasting, pan frying, and grilling. By the way, the Bible said that if people were going to eat meat, they should only boil it, which would prevent the temperature from increasing beyond 232 degrees Fahrenheit, which would prevent the formation of many of these compounds. These HCA PAHs have been shown to increase risk for kidney, colon, lung, breast, and pancreatic cancers. These compounds are also mutagenic, meaning they cause damage to DNA that can lead to cancerous transformation in tissues. In one study, consumption of processed meat, fried and stir-fried meat, and HCA intake were correlated with the level of precancerous mutations in breast tissue. And there's one particular heterocyclic amine called PHIP, which also has been shown to have estrogenic activity. In other words, it acts like estrogen, activates the estrogen receptor on breast cancer cells, and can stimulate breast cancer growth. Now, this is really important because there's been a lot of controversy and deliberate gaslighting and misinformation from the animal food industry about dietary fat intake and its impact on health, cancer risk, and heart disease risk. And essentially, when you look at those studies that purport to show no relationship between fat intake and the risk of developing disease, they typically look at people who are consuming more than 30% dietary fat by dietary calories. And what I need you to notice on both of these graphs, so the top one looks at colon cancer as a function of fat intake, the bottom looks at breast cancer, is that if you are consuming at least 30% of your dietary calories as fat, at that point, doesn't matter whether you're eating 30% fat, 40%, 50%, or higher. You have already plateaued in terms of your risk. So to significantly reduce risk related to dietary fat, you have to decrease your fat intake to less then to 25% or less of calories, and then you get a distinct decrease in the risk associated with dietary fat. So again, research shows there's no decrease in risk unless your fat is less than 20 to 25%. This data from epidemiology studies like the China study also support this view. Other studies show that a significant reduction in dietary fat can halt and or delay progression of breast and prostate cancer. The Women's Health Initiative showed that the subgroup that decreased their fat intake the most had 22% less breast cancer. Animal fat has been consistently shown to be the most problematic with respect to increasing risk for cancer, and that is relative to vegetable fat. And ruminant fat, such as that which comes from cows and sheep and so forth, naturally contains trans fats, which also increase risk for cancers and heart disease. Animal fats also contain high levels of persistent organic pollutants and environmental toxins because of biological concentration. And animal fat also has been shown to suppress immune function in high amounts. And this is a study looking at breast cancer intake as a function of per capita fat intake. And what you see in this study, and this slide is courtesy of Dr. T. Colin Campbell, is that when women move from an area like Japan, where they tend to have a low fat intake, to a country like the United States, and their fat intake increases to be commensurate with that of their new population, that their risk increases and equals or maybe even exceeds that of where they're now living. Importantly, food spends more time in our colon than in any other gastrointestinal organ. And this brings up the concept of dysbiosis. Dysbiosis is a term for pathological microbial imbalance or maladaptation inside the body. In other words, having a microbiome that promotes disease rather than health. Diets high in animal, dairy, protein, or animal fats cause unhealthy changes in the gut microbiome that can elevate the risk for cancers and other metabolic diseases. So you see in these two pyramids that the pyramid on the right, which is weighted towards animal foods, increases dysbiosis, leading to chronic disease, whereas that on the left, which is based on plant foods, gives you a much healthier microbiome and decreases the risk for chronic disease. And low fiber diets, carbohydrate depletion in the distal colon results in increased productions of toxins like ammonia, that's what NH3 is, toxic amines, phenols, and sulfides, and other putrefactive compounds. Hydrogen sulfide, which is produced from this animal protein residues, impairs cytochrome oxidase, DNA methylation, which helps stabilize our DNA and also interferes with tissue metabolism. Western diets can actually deliver up to 12 grams of animal protein residues per day to the colon, which can end up causing as much as 4 grams of ammonia to be produced in the colon every day, which is one of the reasons that the stools from people who eat meat smell so foul. And this is equal to creating 60 to 70 kilograms of ammonia over a 50-year lifespan, which again helps people understand why this can lead to colon cancer. Ammonia concentrations found in the lower bowel of meat eaters destroy cells, alters DNA, RNA synthesis, and increases viral infections and promotes the growth of cancer cells. Dysbiotic bacteria can also retoxify carcinogens by reversing the detoxification actions of broccoli-stimulated detoxification enzymes. 1 month on a plant-based diet will increase populations of the healthy bacteria and reduce those pathogenic species. Studies show this changeover results in reduced intestinal inflammation and also results in improved metabolic and immunologic parameters. By contrast, anaerobic degradation of animal protein residues is putrefaction and generates multiple toxic compounds. Animal food-based bacteria can directly injure the mucosal barrier, thereby causing leaky gut phenomenon, as you see depicted over on the left, and that can allow bacteria and bacterial toxins to enter the bloodstream. Dysbiotic bacteria influence tumor progression via chronic inflammation, altering the tumor microenvironment, and by generating toxic bile acid metabolites and other bacterial antigens and toxins that increase cancer risk. Chronic inflammation increases cancer risk, tumorigenesis, and tumor growth through elevated cytokines, chemokines, and bacterial antigens and toxins. And dysbiosis has also been shown to be associated with gastric or stomach cancer, colorectal cancer, breast, and prostate cancer.